Good evening and thank you for watching. A respiratory illness with cold-like symptoms is spiking here in Hawaii, and it's not COVID.
Yeah, it's called RSV, and KITV4's Jeremy Lee joins us now with our top story and more on how it's affecting children here in Hawaii. Jeremy.
That's right, Mika and Rick. It's not just in Hawaii, but across the country that cases of respiratory syncytial virus, RSV, have been up. That's had some parents I spoke to today in Honolulu waiting at the ER for 5 hours or more for their kids to be seen. Gavin Silva arrived at Kapiolani Medical Center to find a line ahead of him at the ER. Several others waiting hours so their children with similar symptoms could be seen.
My kids were coughing and they had runny nose, and it just sounded out of the normal, so we just had to make sure that they were safe.
But COVID hasn't been the main worry here. Hilton Rathel of Healthcare Association of Hawaii says serious cases of respiratory syncytial virus, or RSV, could require antibiotics administered via IV or oxygen if the airway is constricted.
What we're most concerned about is keeping children hydrated. If their airways are blocked, if they're experiencing respiratory distress, then they may have trouble drinking or eating, and so they're not getting enough fluids.
For Gavin and his family, news of a recent tragic case had him concerned.
Our good friends, they just lost their child to RSV, which even more so made me, want to come in and make sure my kids is, safe.
It is very unusual for these cases to be fatal, but unfortunately it does happen. Just like every year, typically, we would have some adults and children die from the flu or pneumonia.
Which, in addition to COVID, RSV is another virus that is taxing Hawaii's healthcare system.
But when it comes to pediatric intensive care, most of that is done at Kapiolani Medical Center for Women and Children. They have a 14-bed pediatric intensive ICU, and right now, that unit is completely full and actually overflowing.
And with the increases in severe cases,
our capacity or ability to treat those patients is being stretched right now. It has been that way for a number of weeks, and what we're most concerned about is this is very early in the season.
Healthcare professionals stress the virus known as RSV is not new or unusual, especially at this time of year. But in order to address the influx of cases all appearing in a relatively short period of time, Kapiolani Medical Center is turning to team-based care to handle the caseload. Reporting live, Jeremy Lee, KITV4 Island News.